Off the top tonight, the COVID surge is not taking time off for the holidays, and the situation in Ohio hospitals is only getting worse.
There are now more than 5,000 COVID-19 patients in our hospitals, numbers we have not seen in over a year, and more than double what it was just 2 months ago. Nearly half are right here in Northeast Ohio, where 1 in every 3 patients in our hospitals has COVID.
And after a weekend of holiday gatherings and busy travel, health leaders are now dealing with the latest rise in COVID-19 cases. Another 8,000 new cases were reported in Ohio today, and our 7-day testing positivity rate hit another new record high, 24.2%, meaning nearly 1 in every 4 people are testing positive. If you're looking for a COVID-19 test right now, you are not alone.
No, you're not. News 5's Clay Lepard shows us how the new cases are adding up for area hospitals.
Over the past week, Cuyahoga County and Cleveland quickly became one of the hottest hotspots when it comes to new cases of COVID-19, forcing places such as the Cleveland Public Library to close their doors except for walk-up and curbside service.
You can still get books, you can still print. There's just a ton of things that you can still do even though you can't come into the building.
One facet that will continue, offering COVID-19 at-home test kits. Robin Wood with the library says they just received a couple thousand more tests Monday morning. They're already gone. Like many other libraries, it became a popular place to find at-home COVID test kits, fielding calls like an ongoing telethon.
The staff in the lending area that picks up the phones here at the library, it's like every 5 minutes.
Elsewhere, securing enough test kits remains a struggle. In Geauga County, health officials posted an update that they would only be able to fulfill a small amount of their test kit requests. In Tuscarawas County, 1,000 kits ended up being handed out in record time Monday morning. And in Lorain County, they just received a shipment of about 600 tests, available through the Lorain County Urban League and El Centro. In Canton, Health Commissioner Jim Adams says they don't have enough test kits to hand out to the public, just enough for outbreak investigations. But past the test kits and the drive-through testing lines, Adams says he hopes people notice the bigger impact from this moving forward.
We just have to see where this wave is going to take us.
For his own staff, that means an increase in their own COVID cases and close contacts, as well as a reported 25% increase in COVID-19 deaths over the past week. A surge he doesn't expect healthcare workers to see subside anytime soon.
This last surge is just about enough to push them over the edge. And it's really hard on our hospitals and folks that are providing that level of care.
Clay Lepard, News 5.
Wow, the surge in cases and the increased demand for tests is, of course, why the National Guard is helping local hospitals set up those drive-through testing clinics like the one at the W.O. Walker Building Garage in Cleveland that opened last week. We just clicked on the link to sign up for an appointment about an hour ago. After a long wait, a page came up saying all of the time slots at that testing clinic are full. We're now trying to figure out if they will extend testing at that location into next week. Another drive-through testing site is opening in Summit County tomorrow, but we didn't see any appointments available there either.
Okay, so what happens if you were able to get your hands on a COVID test and it comes back positive? The CDC says it is important to stay home and avoid others, and just minutes ago it updated its isolation recommendation from 10 days to 5. If you live with other people, that means staying in a separate room and reach out to those you've been in contact with.
Fully vaccinated people, particularly those with a boost, are highly protected. But due to Omicron's highly transmissible nature, we will see fully vaccinated people get COVID. They'll likely be asymptomatic or feel under the weather for a few days.
And keep this in mind also, an infected person can start spreading the virus about 2 days before developing symptoms or testing positive.